Thank you so much for your kind words. Appreciate that. And I'm delighted to be here. I see some old friends in the audience, long-standing friends, not necessarily so old, with whom I've worked before. And I'm delighted to see so many new faces in the audience, particularly those of you in the child welfare arena, with whom I have not had an opportunity to work, and I hope this will be beginning of a collaboration. You mentioned collaboration being so important, and Jim and I were recently at a meeting where one of the speakers said, and it may be an expression you've heard before, that collaboration is an unnatural act between two consenting adults. And that may be the case. You all know how difficult collaboration is, and hopefully some of the material you'll be hearing today will facilitate that process. For obvious reasons, I'm not standing behind a podium. I thought maybe you'd like to see more than my forehead. So I hope that all of you in the back can see and can hear some of the things I'm about to share during this presentation. During most presentations, we ask you to put your cell phones away and silence them. In this presentation, I think it would be great if you all took your cell phones out. You can still silence them, but we are hoping that we'll have an interactive component by which you can vote and provide your own status and your opinion in certain areas that we'll be talking about. And that'll give us a sense across all of you about where you are in certain areas, what your thoughts are, and where there might be areas of improvement in your specific counties and your specific areas in the state. Let me also say, while we're waiting for that to come up, that there are polling instructions in your packet. It's very easy. You simply text your responses to a number that's provided on this green sheet, and there are some other alternative ways to do that. If you don't have a cell phone, I am sure that somebody next to you will. So you may be able to share that, hopefully, and that would be the first collaboration we'll see today at this forum. So do that. And there are also ways to connect to the polling online as well, and there are instructions on how to hook into, get online through the procedure here in this room. I'd also like to point out that we put on your table some flyers for the Georgetown University Training Institutes that will occur this July in Washington, D.C. How many of you have attended training institutes before? Oh my goodness, only a few. So we're hoping to see many of you there in July. It's a wonderful opportunity for training on systems of care. We have attendees across all partner child serving agencies there. And I think there's a lot of material, in-depth strategies, practical ideas for how you can achieve some of the agendas that are being pursued here in California. And I hope I will see many of my new friends among you there in July. That was kind of a shameless plug for the work we're doing at Georgetown, but we do hope to see you there. So where I'm going to start to talk with you today is really about building blocks. And we believe that you're not starting from ground zero. Your counties have already done a tremendous amount of work to provide mental health care, behavioral health care to children in the child welfare system. So the concepts that we'll be presenting today don't ask you to throw all that out. They don't ask you to start from the beginning with something entirely new. They really ask you to examine what you already have in place, the building blocks that you already have in place within your counties and within your systems. Use that as a starting point and build on them. And the idea really is to improve outcomes, as you all know. Certainly we can all agree on that, to improve outcomes for children, for families, for caregivers, foster families, kinship families, and all those systems who are involved with children and child welfare, and then also to invest your resources more effectively. So here we're asking you, build on what you have. You have a foundation. You have done some work on this before, probably lots of it, and you can improve what you're doing by implementing some of the strategies we'll be talking about this morning. First, I'd like to spend a little bit of time reviewing some of the key points of a system of care approach. Let's see just a quick show of hands about how many of you are familiar, at least at some level, with the concept of a system of care. Okay, so when we get to the poll, I think there'll be a lot of numbers in that area as well. I just want to review some of the key concepts, some of the high points, a little bit of System of Care 101 for you. It's a framework, it's a philosophy. It really has shaped the work of a lot of states and communities and regions and tribes and territories. And we really now are very pleased, it's gratifying to see that there are some elements of systems of care in almost all communities across the nation. Maybe not the whole shebang, but there are certainly elements and pieces of systems of care that have been implemented very broadly, that it shaped national policy, Surgeon General's report, President's Commission, both Clinton's, and then later the President's New Freedom Commission under Bush. And it's really been used also as a reform across child-serving systems. Many of you are familiar with the grants that were given by ACF, the Administration on Children and Families, to use this exact approach and philosophy to create a more comprehensive system of children and families served in the child welfare system. And California was one of the early innovators in the system of care approach. And in the 1980s, you may remember Ventura County. I visited Ventura County early in the 1980s when I was in kindergarten. And you have continued in California to move forward with the system of care approach in many, many areas, as I'll show you in a moment. Here's the definition of a system of care. It's been recently updated. We have added a few elements to it. It's been 25 plus years that we've been talking about systems of care. We added the effective community-based services and supports, which really refers to evidence-informed practices. We added the concept of children at risk, not just for those already diagnosed with serious disorders. And of course, a coordinated network, partnerships with families, cultural competence. And then we added the ultimate goal, of course, what it is we're trying to achieve, which is to improve the functioning and the outcomes for children and their families. In its most simplistic way, I like to talk about a system of care as simply this. It's an array of services and supports. It's supported by an infrastructure that has some very clear elements, and it's guided by a philosophy. So it's not something that's really complex. It's not something that needs to be difficult to understand. It really is this network of comprehensive services, home and community-based services, both in-home and out-of-home as well, and an infrastructure that has many elements, which I'll show you a little bit later, and that's guided by a very well-defined philosophy, which now is really broadly accepted across many child-serving systems. And I want to add here that people don't necessarily use the terminology, the word system of care, or some of the terms that I'll be sharing with you this morning, and I don't really care about that. The idea is the basic philosophy, the basic approach, and we see that, and you'll recognize some of that going on in your own counties.